This is Michael Osterlink. Welcome to O Radio, where we explore individual and social transformation through collaborative action. I'm a psychotherapist with a transpersonal and somatic specialization. I'm also a transpartisan social entrepreneur and head instructor at SEALFIT's Unbeatable Mind Academy. Today's show is brought to you by Cosper Scafidi, an amazing bottle worker in Northern Virginia who utilizes many different somatic practices in his work, including biodynamic and mechanical craniosacral therapy, visceral manipulation, neuromuscular myofascial processes, and rolfing. You can learn more about Cosper's work, at www.cosperscafidi, that's COSPERSCAFIDI.com. Our guest today is Dr. Lara Pence. As a licensed clinical psychologist, Dr. Pence has worked with Olympic athletes, successful business owners, and entrepreneurs. Dr. Pence serves as Chief Wellness Specialist for Spartan and hosts Spartan Mind, a weekly podcast. She also works with me at the SEALFIT's Unbeatable Mind coaching program, helping coaches serve their clients effectively and purposefully. She also has been featured in various publications and media outlets such as Good Morning America, the BBC, Glamour, Vogue, WebMD, Psychology Today, and the Huffington Post. How you doing, Lara?
I'm awesome. Thank you for having me. It's crazy when you read off that stuff because I don't think about that. And I'm like, wow, that's not so bad, right?
You know a lot of good stuff. And a wide variety of cool things, from Huffington Post, WebMD, Psychology Today.
Right.
That's pretty badass, I must say.
Yeah, it's nice. I like the idea that seeds are being planted kind of in lots of different minds and lots of different arenas. Like that's super hopeful for me.
Speaking of seeds, when did becoming a psychologist get planted for you and why?
Yeah, great question. It's funny. In 8th grade, we had like a behavioral science class, and it was the kind where you had an egg and you had to pretend it was like a baby and carry it around for a day and not crack it, that kind of thing. And I remember there were a few different lessons that we went through in the class that I just found like super fascinating, like social psychology and the way that our unconscious influences our behaviors and that kind of stuff. And I just remember in 8th grade thinking like, this is so cool. Like the fact that we can engage with the world in really such an intentional way that we don't even know we're doing, whether it's like through confirmation bias or other sort of psychological phenomenon. So that was actually when the seed was planted. And then I think it just grew through, lots of different encounters with other individuals who, were suffering. I had a best friend in high school who had an eating disorder, and that was really interesting for me, but also really difficult for me because she was one of my close friends. So, lots of other sort of stories along the way that I think built up to this being a natural entry point for me. And of course, here I am, 10 years out of graduate school, or more than 10 years out of graduate school now, and feeling like this profession has taught me more about myself than maybe anything could. So it's sort of like, well, of course I got into it so that it could also teach me certain lessons and challenge me in a way that would kind of elevate my contribution to the world, I think.
Now, when you were in college, did you know that were you doing like prereqs for going into
Totally.
the program?
Yeah. Like as soon as I got into college, even before when I was applying, I knew that I wanted to do psychology. I had kind of toyed around with like doing some animal behavior stuff and maybe becoming a vet, but then like the idea of, surgery and all that kind of stuff. I was like, no, I'd rather stay up in the head, like in the mind is where I need to be, not quite in the rest of the body. And then, when I finished college, I just knew like I wanted to be a psychologist. And I also knew that I did not want to do research. That was like also very clear to me that I wanted to be working specifically one-to-one with clients. And I remember actually that when I first got into graduate school, I was a little discouraged because there were quite a few other students who I was in class with, and even professors who would kind of throw out there, well, it's really hard to start a private practice. And, psychologists are a dime a dozen these days. And like, it was a little bit not as encouraging as I would like, but I was determined, and thankfully, the path kind of unfolded for me in that direction.
Well, having heard you interviewed in the past, having now worked with you a little bit at Psychotherapy Unbeatable Mind Academy, you seem to have a unique approach to coaching. I'm curious, when you were in grad school and you finished your PhD program, was that the way you now approach it, how you were taught to work with people? Or is it
no.
I can imagine so.
Yeah, there has been a wild evolution of the way that I practice since being in graduate school. I went to a very clinical program. It was called Widener University. And it really was primarily for individuals that wanted to become practitioners, like clinical practitioners, not researchers. And so from like the third month that we were in programming, and it was a 5-year program, we were starting to do therapy with clients, like 1-to-1. And when you go through graduate school, you learn a lot of the modalities and the theories, CBT and ACT and DB, all of, the alphabet soup, right? And when I got out of graduate school and really started practicing, I tried to keep in alignment with a lot of that stuff. And I think that that's actually really good for individuals coming out of graduate school, because you certainly don't want to be like, who cares about that? I'm just going to do what I want to do. Like, you want some kind of structure. You definitely want a little bit of a playbook guiding you in the beginning, because it's difficult work. And it's also, intense work in the sense you do have a responsibility to ethically and morally provide your clients with the best care. So, in the beginning, I would say that I felt kind of much more structured in the way that I was working with clients. And then I really began to learn a few things more about myself, in the sense that, like, that was not really my style, that I am definitely a much more active, engaged, energetic practitioner. I want to get in there. I don't want to just sit back and say,
how do you feel about that?
Yeah, exactly. Tell me how that feels. When they ask me a question and I say, well, what do you think? I found myself craving more collaboration, craving more involvement. And I think as I began to get more confident in my own skin, just growing up and maturing, I began to transition a little bit away from some of that more structured position and really move into a style that felt like it was my own. Certainly taking the knowledge and the wisdom that I had learned in graduate school, but allowing myself to find my own footing, I guess. So it's been an evolution.
For Psychotherapy Unbeatable Mind Academy, some of the things that that we teach, because you teach it as well, is toughness, emotional resiliency, listening to you on Spartan podcast, and knowing about Joe's work, emotional resiliency, mental toughness is a huge part of Spartan ethos. What led you to where you kind of the structured, cognitive behavioral, ego psychology, blah, 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 all those schools of thought, to kind of this kick-ass coach psychologist that you are now? Kind of walk through like that transition, that evolution.
Yeah. So, well, like I said, I think the more that, again, the more that I felt comfortable in my skin, the more that I just matured as an individual, the more life experience that I had, being married, having children, starting my own business, the more that I began to really feel like, if I'm not using my voice, I'm not operating from a place of integrity, right? Like, if I'm trying to show up in the room as somebody that I'm not, it's not going to serve me, and it's definitely not going to serve my clients, So I think I really began to see that. And that even played out with some of my clients, early on in my work with them. I mean, gosh, now I think back to some of the early clients that I had, and if I had their contact information, I would probably call them and say, I'm so sorry. I didn't know what I was doing. So, I think I also, as I said, I began to see that play out in my clients, that the clients that I was working with, who I was more myself with, and just sort of more engaged, energetic, and sort of working from this angle of building up toughness and resilience. Because that's kind of my upbringing. Like, I was always taught to just be a tough girl. I never thought, it's sort of crazy to say this, but I actually never thought that I couldn't do something a boy could do. It just didn't cross my mind, maybe because I had a best friend who was a boy growing up. But so when I noticed that the clients who I was more myself with were actually, improving and making changes in a meaningful and purposeful way at a faster rate than the clients who I wasn't myself with, that was a big clue. That was like, okay, I need to shift.
When you finished grad school and started working with clients, was there a niche or area of human activity that you're more interested in others, like a population that interests you?
Yes. Yeah. I immediately, in graduate school, my last 2 years, I spent 2 years working at a residential treatment facility for women and girls with eating disorders.
Well,
And then that was really, I was hooked. I mean, I was fascinated by the disorder. I was in awe that these unbelievably intelligent, creative, just wonderful people were killing themselves through their relationship with food. And I had some of the best supervisors, that really just allowed me to find kind of my groove in working with that population. So immediately out of graduate school, I started working in that population and actually was the director of a facility, and then opened up a private practice primarily for individuals who were struggling with eating disorders. And that also kind of gradually moved into and shifted into working with professional athletes.
To talk about that shift.
So I started getting referrals for gymnasts and swimmers and wrestlers who were struggling in their relationship with food, and runners. As I would do work with them, and, it seemed to be good work, they would refer me to, or they would refer their friends and their, colleague athletes back to me and say, I've been working with Dr. Pence and she's been super helpful. And so I would get calls from other professional athletes who would say, hey, I don't have an eating disorder, but I'm really struggling in, X, Y, or Z, in feeling good about myself after races or in performing the way that I want to. How would you feel about taking me on as a client? And I would be super upfront with them. Listen, I don't have an expertise in sports psychology, but I do have an expertise in helping you uncover this clouded relationship with yourself that is impacting your performance in life.
Okay.
And that's kind of how that transformation into working with athletes started, actually. It was really referral based.
What's interesting about food addictions or food troubles or disorders versus like addiction to drugs and alcohol is like everyone has to eat.
They do. Yep, they absolutely do.
That's got to be a really big challenge compared to not saying drug and alcohol is easy, but you don't need drugs and alcohol as you need food to survive.
Well, exactly. Try telling a recovering cocaine addict, you're going to have to do 3 lines a day in order to recover. It's like, what? So yes, it is a nasty disorder. I mean, it has the highest mortality rate of any mental illness, which a lot of people don't know. And there's a lot sort of behind the disorder that I think too often gets missed when we talk about it. It's really a disorder of the self. And it manifests itself in a relationship with food and with one's body. But it's, I think we're learning a whole lot more about it as we study the brain and things of that nature. And more people are talking about their own struggles. We've got a lot of, or not a lot, but more men coming forward, talking about their struggle in their relationship with food. But yeah, it's a difficult one. And I think, unfortunately, the way that our society sees and handles food and, is so misinformed, contributes significantly.
So that leads me to a question, the cultural aspects of it. Mm-hmm. I don't know if there's been cross-cultural studies, but do we see this in other non-Western countries?
So yes, but it is really interesting. There was this study done in Fiji once, quite a while ago, but Fiji had like no access to media. And then they took a control group and gave them access to media, and the rates of eating disorders shot up. Culturally, I think, unfortunately, there is a big contribution. I would not say that it is like the inception or the onset. I think sort of like alcoholism. I mean, you can have somebody who comes from the same family and have, sort of the same genetic makeup. One person has a drink and they can never stop. The other person has a drink and they could care less if they have another one, but it's a little bit like, genetics and biology loaded the gun, but environment pulls the trigger. I think culture has a huge impact on it. And unfortunately, our social media culture right now is absolutely perpetuating some of the difficulties.
If eating disorders are perhaps a symptom of something internal, is it self-worth? I mean, is there something similar between all the patients that you saw?
Yes, absolutely. Shame.
Okay.
The feeling that an individual is not good enough, that they're not worthy and deserving of love and belonging, deep rooted levels of shame. And unfortunately, I think in our culture right now, shame is a silent killer and it's pervasive. I mean, we all experience shame, right? Like it's not siphoned out for individuals who struggle. It is a thread of common humanity that we all at some point experience some degree of shame. But in my work with eating disorders and with individuals struggling with eating disorders, it popped up all over the place. Just this idea that, they did not deserve to be on the planet, that they were not worthy of love and belonging, just a level of deep insecurity and shame that was profound.
So it sounds like if that's similar with all the clients you saw, I imagine that there's a systemic piece to it, not just cultural, that pulls the trigger, as you say, right? But pulls the trigger, and not just subjective, but there's systemic or familial patterns,
big time,
that bring that up. Is it intergenerational? Is there something intergenerational about this as well?
Oh yeah, sure. So individuals with eating disorders are 7 times more likely to have an eating disorder if someone else in their family has an eating disorder. And I'm a huge believer in generational trauma. That our trauma trickles down through generations. And so I think trauma is also really pervasive in the eating disorder community. And so I think a lot of that contributes to kind of the development. I mean, really in a lot of ways, when I work with individuals with eating disorders, primarily what I'm seeing is a fracture in their relationship with self. They don't love themselves. They have very little investment in elevating themselves, or really feel stuck, like they can't, and that they're not deserving, like I said. So there, it's a complex piece.
Now, obviously, I'm going to ask you a question, like how do you help shift that in someone? And we only have a little bit of time. We don't have hours and hours and hours. But, if you can condense how you might work with someone with an eating disorder to shift how they perceive themselves so they do have self-worth and operate from that space. How do you go about doing that?
Right. It's a great question. So, first, and this is, I guess, just primary with anyone that I see, but especially in working with individuals with eating disorders, establishing a really good rapport is key, right? Like making sure that we have a really good relationship, making sure that they see me as human, that I also have flaws, that I'm not perfect, that I, have shame issues, we all kind of have this stuff, right? Just so that ties in a little bit of that like common humanity piece. Like we're kind of in this together. I don't have an eating disorder and I haven't ever struggled with them, but I see your pain. Like I know what it's like to feel alone. I know what it's like sometimes to feel angry, that kind of thing. And then a lot of it comes with compassion and emotion regulation. So teaching them skills to have self-compassion, so that when they struggle or when they fail or when they, come up against difficult times, asking them to look inward and be kind to themselves, not necessarily condone certain behaviors. A lot of people get that confused, that compassion is condoning, but to know that we, again, like we all struggle. We are all on this planet. You are not on a separate planet. You are actually on Earth with the rest of us, where the rest of us also have a difficult time. And then really a lot of emotion regulation skills. So a lot of, teaching them some different emotional vocabulary, what is it that you're really feeling right now? Those kinds of things, asking them to tolerate different emotions, especially some of the ones that people would identify as painful, tolerating stress, tolerating disappointment, tolerating discouragement, tolerating shame, and working with them in those pieces.
Do you integrate somatic awareness practices and meditation and things like that?
Yeah. So here's what I've learned, which, I could get some pushback here from other psychologists that are listening, but talk therapy is not everything. It is definitely not everything. And especially I feel with individuals who have such a fractured relationship with their body that I would have to refer out because it's not my area of expertise, but I would often refer my clients to professionals who, integrate yoga into their practice, somatic professionals, dance movement professionals, art therapists, because we actually do not have voice language for everything that we're thinking or feeling or experiencing. And so to be able to, transition back into the body, to be able to understand your body in a way that you haven't for so long because you've been punishing your body for so long, or putting it through so much distress, I think is key. And I will be the first one to raise my hand and say, listen, you got to start working with somebody else. Or working in conjunction, because talk therapy is not going to take you to the finish line all the way.
I have to imagine it's interesting working with athletes who most people would imagine have a good relationship with their body.
Oof.
At least my experience is they have a good relationship with their body as a tool to use for a certain event or a sport, but not a really good subjective relationship with their body.
Yeah.
Felt organic experience.
Absolutely. And I don't know if you experience this too, but it is difficult because especially when you're working with elite athletes, Olympic athletes, they have to push through certain feelings and sensations that make the work really difficult. They really have to push through pain. They have to get through a point, they have to push their body into a position of its most ultimate limit, which sometimes goes against, the idea that when your body says stop. For them, it's like when my body says stop, I got to keep going. If I want to make time, if I want to, get through trials in a way that I feel good about. So it is interesting work, but definitely my experience is that there is a disconnection there, that if they even begin to see their body as like a real vehicle, not only for the product of their performance, but also like a product for their contribution, that they treat their body well in recovery and they do the things that they love doing, that kind of thing I think can also be really, really helpful.
Yeah, it's interesting because, at SealFit, we talk about 20X. You can 20X, people
Right.
20 times more than they think they can do.
Yep.
But one thing that I discovered, and I'm curious on your thoughts too, and it sounds like you fit in with what I'm about to say, is that some of the people attracted to SealFit or to Spartan Race are AAA personalities. They're go, 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 go.
Yeah.
For them, they don't need a 20X performance. They actually need a negative 20X performance. A lot less. They need to be with quietude and solitude,
Right.
be with themselves, not always performing at 110%.
Right. Totally. And that's hard.
Yes.
It is really hard. I mean, I am certainly not an elite athlete, but just even recently, when I run fast, and I mean, nowhere near like what other people might consider fast, but recently I've been trying to train my body to be more comfortable running slower so that my heart rate is in a certain level. And that is even really hard for me. I want to keep going and I want to push myself and go fast. And I'm like, do. So for these athletes that do this for a living, it's I think it can be really difficult. And if you're working with somebody who has a coach, like a running coach, or they in their specific sport, which many of my clients do, sometimes I'm bumping up against that coach a little bit and helping collaborate with that sports coach on like, listen, we've got to get him thinking too about his mental game. We've got to get her thinking about her resilience. We can't just have them focused on the clock, looking at their Garmin every time they're hitting a mile mark, that kind of thing. That collaboration could be really helpful, but it doesn't happen as often as I would like for it to.
You just mentioned the coach, and you mentioned on occasion you'll refer out to somatic practitioners or yoga therapists and stuff. And we talked a little bit earlier about kind of a systemic approach. You know, there's cultural aspects, there's familial aspects, there's individual aspects. How do you, if you do, bring in spouses or other people into the work when you're working with an individual?
Yeah. I think it has to make sense for the work, right? I mean, there has to be a place for it. There has to be a call for it. But if you look hard enough, it always makes sense for the work, in a lot of ways, because we need each other. We need connection to heal. And I am a huge believer that connecting is a healing agent, and that we've gotten so disconnected from other people, and from ourselves. So, oh my gosh, right? Yes, exactly. Checking out that iPhone, looking on that iPad. So usually in my work with clients, it's interesting, actually. I would say that a lot of my clients bring it up first, like, would it be okay if, I brought my husband to the next session, or how would you feel about, me doing a session with my best friend, or whatever it is. And so I think, usually, unless there's a reason for me specifically not to work with that individual, that it would sort of put me in a place of being out integrity. For example, let's say I'm working with somebody who's having an affair, and then to have their spouse come in, but I know this information, and, I know that it's clearly having an impact on their marriage, but I can't talk about it, or that doesn't feel so great. So I would refer them to a marriage counselor. But I would say that usually, the invitation is there, and then we just thoughtfully work through what would that look like. And what's the role of your support system who's going to be coming in and joining us in this session, or joining us in the work that we're doing? What is the purpose? What's the intention?
And that's what I find a lot, because people kind of on the path of personal development, if their spouse is not on that same path, it doesn't have to be the exact same path, but on a path of personal growth and development, whatever their path might be.
Right.
I find that, the headbang, the butting up against each other, like the one spouse is afraid and fearful of this other spouse growing, deepening, personal development type stuff. And they do things to kind of stop it as much as possible, either consciously or unconsciously.
Yep.
And I find that to, be stifling for the individual who's the client, but also stifling for the partner, because,
Yep.
They're both locking themselves into a status quo, which is not serving them.
Yeah. No, I mean, I think that's a great observation, and certainly one that I've seen before, which is what part of the reason why I do think it's so, you have to communicate with the people around you who matter to you. And, not everybody's going to have the same values as you or path as you, but especially if it's an intimate partner or somebody that's close and can support the journey that you're on, like, they've got to at least be aware of this train that's happening, and not digging their head in the sand and not wanting to hear about it. That's just not helpful.
Right. I mentioned at the very beginning when I was introducing you that you're both affiliated with SealFit and Spartan Race.
Mm-hmm.
You do the Spartan podcast. How has your relationship to Spartan affected your work as a psychologist, or has it?
Yeah, I would say that it has in a couple of different ways. One, it's sort of interesting. I'm a big believer that you have to have your eyes open for the signs that things need to change. And I was at a point in my private practice, like many, I'm sure, having had a private practice for 8 years, where I was feeling a little tapped out. Private practice can actually be a lonely work. You're in your office all day, just seeing clients. If you don't work in a group practice, it's just you. And I was at a point in my life and in my career where I was just craving more. And I kid you not, like the very week that I was talking to my husband about, I think I want to do more. I think I want to get outside this box. I got this phone call from Spartan.
That is awesome.
And, initially too, here's the other thing. Initially, I think I had been much more attached to the word no than I was to the word yes in some of my work, really making sure that every single client that came through my doors was appropriate to, in the line of work that I was doing, and kind of saying, no to a lot of requests to work with people because I wasn't sure that I was the best person for them, or wasn't sure that we were the best fit. I felt like I was saying no a whole lot more than I was saying yes. And when I got this call from Spartan, I was, again, kind of at this point in my life where I just needed something different. And I was like, I'm just going to say yes. I'm just going to say yes and have this one meeting with Joe DeSena and these other people and just see how it goes. And that yes served me really well because I just kept saying yes to things. And in the past year, I've started doing things that I never would have dreamed that I would do, go to Japan and South America to film these online education courses that we're hoping to, roll out shortly. And so I realized, this is a long story, but I'm getting to the point, that my work with Spartan has allowed me to become much more available to yeses in my life. And I feel as a psychologist, it's really important to remember that part of things, because one of the things that I have worked a lot with my clients is boundaries, right? Setting no, saying no, allowing yourself and giving yourself permission to say no. And I guess I realized that I was saying maybe too many no's and it wasn't serving me. And so the more that I started to say yes, the doors really opened. And so I think I kind of shifted. I've had a little bit of a shift in my mindset around the power of yes, as opposed to the power of no. And that has helped serve my work for sure, because with some of the clients that I have, a lot of them, for example, are entrepreneurs or individuals in senior leadership positions in business. And a lot of them are used to saying, no, we can't do that. Nope, it's not going to fit in the budget. No, we're not going to hire that, And I think sort of my own experience has allowed me to get them curious about what would it be like if you said yes,
Yeah.
Yeah. So that's how I would say that's been the main and major impact in my life.
Would you say that part of the yes is both risk-taking and openness to the unknown?
Totally. Yes. Which I think, in so many ways is sort of in alignment with Spartan, right? It's how do you move into and lean into the uncertain? And it's scary, and there are times certainly where I'm like, oh my goodness, what am I doing here? But it feels good. I feel so in integrity with my own value system, but I definitely think that part of the reason why we don't say yes to things more often, or yes to things that are risky or uncertain, is because of that fear. What happens if I say yes to this and it doesn't work out? Or what happens if I say yes, but I lose that other opportunity, Right.
Now, if people want to work with you, how do they find you?
Yeah, so you can go to my website. It's just drlarapence.com. I'm also on Instagram with the same handle, Dr. Lara Pence. You reach out to me directly through that. My email is lara@drlarapence.com. I'll certainly shoot you an email back. And then through Spartan and Spartan Mind, and then of course the Unbeatable Mind and the coaching program, and that the awesomeness that is, for sure.
Awesome. Well, Laura, thank you for your time. It's great to talk to you in this way.
Oh, you're welcome. It's been, I mean, these conversations just with awesome people are again, it's another thing where I'm like, oh my gosh, how is this happening? How do I have to have such cool, enlightening conversations?
I appreciate that. And it's great to have you as a guest on my podcast, but also as a colleague at SealFit's Unbeatable Mind.
Of course.
So I'll see you on the web soon.
Awesome. Take care.
You too. Bye-bye.